Are you a mom who is sick of your child always rejecting the food you prepare? You keep trying and making different foods, yet the child keeps saying, I don't want to eat this food, or probably cries all the time over meal times. And this same reaction every single time. Let's talk about it. Your child might actually be a picky eater. Picky eating in children means when a child usually rejects most types of food all the time, prefers to eat the same meal every single day, or prefer junks over whole foods. Picky eating is common with children between ages 2 to 5 years, and this is because this age is when children begin to learn independence. They tend to become more sensitive to taste and texture of foods. So, as a mom, you don't necessarily need to beat yourself or your child up about this. There are ways you can actually help this condition if your child has it. Before we go into that, how do you know exactly that your child is a picky eater? Number one is, like we mentioned before, they prefer a particular group of food. They prefer having rice all the time and reject when you add something like fish or meat or some vegetables in them. Another way to know your child might be a picky eater is all of a sudden the food they used to enjoy, they begin to reject it, like they are no longer interested, and they prefer to take junks, biscuits, sweets, and trash healthy foods like vegetables and fish, meats, and other whole foods. These are the ways that you can know that your child is probably a picky eater. This condition has its downsides, and the downsides, if not managed properly, could result to severe illness. Now we're going to be talking about these downsides that picky eating in children could result in. The first is nutrient deficiency. Of course, the child won't be getting enough of nutrients like minerals and vitamins. And when children lack vitamin C and zinc, it will greatly tell on their immune system. So, picky eating can actually cause nutrient deficiency. Picky eating in children can also lead to poor development and growth. If the child lacks important nutrients that help for growth and development, it will tell on their weight, they get underweight, and it can also affect brain development. When your child is a picky eater, you will notice that it takes longer for the child to recover from illnesses. The child would always come down with cold, cough. A disclaimer, there are other things that can be underlying factors for why your child might be getting sick frequently. So if you discover that your child is sick, it is best to take them to a doctor to be sure of what it is. Now we are over with the three things that picky eating can result in. Let's go over to how you, as a mom, as a dad, can help your child who is a picky eater improve and make sure that they don't come down with nutrient deficiencies. There are five things you can do to help. The first thing is keep portions healthy and small. The food you give to your child, it doesn't need to be big. The size of food doesn't have to cover the whole plate. Just keep it small. The main goal is for it to be nutrient dense and attractive for the child to eat. The next way you can help your picky eater child is to serve healthy foods in different forms. Some kids prefer grated carrots to puddings, some prefer animal shaped cucumbers to grated cucumbers, some prefer mashed potatoes to fried ones. If you don't know the one that the child prefers, you can start with one and move to the other, but just spice up the foods, keep them healthy, but try different forms of the same food. The next one is to involve them in the process of making the food. Children are more likely to eat the food that they took part in preparing. For instance, if they helped you out to wash the vegetables, turn the soup, or helped you out in making the healthy meal plan. Because they are adventurous and curious, they will want to know how the food tastes and might end up enjoying the meal. The next thing you can do to help is to be patient and keep trying. Don't spank, don't shout, don't hit at them for not eating a food. The best thing to do is to applaud them with the little that they eat at any time and encourage them to eat better next time. And finally, consider supplements. Of course, Supplement is not for every single child that is a picky eater. But if you start to notice that the child is becoming severely malnourished and not eating enough of vegetables, proteins, and sticking to a particular type of meal, then you should see a doctor to know if giving the child supplements for some time might actually help. The goal of helping children who are picky eaters is to keep portion size small, fun, and more attractive. So, as a mom or as a dad, you should be patient with them and keep trying. And don't forget to see a doctor before you start any supplements for the child. Also, when you begin to notice symptoms like rashes, worsening appetite, it's best to see a doctor to make sure that there's no underlying medical condition to take care of first. If you enjoyed this video, give us a like, comment, and share to any mom or dad you know should have this information.